Oh, keen to talk more about health checks. As I mentioned before, having a general health check is really great to keep ahead of the game so that we avoid having problems. I mentioned on the last video about having a blood test looking at liver and kidneys, red and white blood cells, thyroid, cholesterol, blood sugar, making sure we're not missing any risk factors for diabetes or heart and stroke disease. Looking at things like vitamin D, that's really important. And I'm just moving something in front of me here. The other thing is, skin checks. If we're older, looking at bone density, getting that checked. Has someone had a bit of a fall and had a fracture really quite easily? The other things is vaccines. Are your vaccines up to date for those who want to have vaccines? There's and check, every year or two. Are my vaccines up to date? Because that schedule can change once or twice a year, and new vaccines become available. So make sure that you're as healthy as possible so that you can stay that way as long as possible. So when we're talking about men's health, we're talking about a lot of the same things as women, but they've got a prostate. And there's a lot of confusion with that one. The prostate screening is a PSA test, which is a blood test, prostate-specific antigen. So anytime we have anything in our body, any piece of our body, it'll produce proteins. And the one that the prostate produces, and it produces more than one, but the prostate-specific antigen is produced by the prostate. Now, as men get older, prostates get bigger. So we've got a changing reference of what is normal. And so when someone gets the PSA test, that blood test, we want to look at it yearly to see that it's just eking up a little bit, that it doesn't have a sudden jump. Most sudden jumps are going to be because the prostate got bigger, but sometimes it's going to be from a cancer. And we need to get you to a urologist and find out, okay? There's things like MRIs now, as well as the biopsy. The key thing to know is that someone can have prostate cancer and the PSA be completely normal. So it's not black or white. It's just like everything in life. It's all about gray. No yes or no, cancer, no cancer. So another component of doing a screen for men's health check is having a feel of the back passage, because we can feel the back of the prostate. Knowing I can't feel the middle, sides, or front, but I have caught a couple of cancers that way. I reassure you, my finger is smaller than the average poo, and I think every man has come away from the exam saying it's nowhere near what they thought compared to all the funny jokes that are out there. So I reassure you that a gentle feel of the prostate is much less invasive than missing a prostate cancer. That being said, this is preventative medicine. There's no pressure to do it. This is all about support for you so that if something develops, we catch it when it's small, early, and easily addressed. All right, I want you to remember getting your blood pressure checked, your bloods checked, check your weight with your height, make sure that you're keeping yourself really healthy. Ask questions about nutrition, so important. It's how we fuel and build the body. We wouldn't put dirt in the petrol tank and expect it to run. Find out what you need to keep your body as healthy as possible so that we're reducing our risks of obesity, diabetes, heart and stroke disease, certain cancers, and even depression and anxiety. Go in and ask about movement. Let us know if you're having trouble sleeping. Look at the quality of your relationships. How do you deal with stress? Everybody has stress. Crap happens. But do you deal with it in a way that takes care of you and doesn't just sort of bash you against the rocks with things like anxiety or other things like drinking too much, smoking too much, all these things that your GP is there to help you address and take care of. All right. Keep yourselves healthy.